So in the end, let me try to recap on what I've touched on. I try to give some historical perspective into this tumor that is essentially Oriental Southern Chinese disease. It's a relatively new disease in the sense it was recorded in history for about 100 years because nasopharyngeal carcinoma is a difficult disease to examine without any instrument. I've gone through with you imaging of NPC, the various anatomy that are important, that when the tumor spreads anteriorly, it goes into the pterygopalatine fossa, and from pterygopalatine fossa, it can go into the inferior orbital fissure, superior orbital fissure, and from there, it can go into the intracranial cavity, either as perineural spread along V2 or through the superior orbital fissure. Then we talk about metastatic disease. In fact, metastatic disease is probably the most common presenting symptom. Patient comes in with enlarged lymph nodes in the neck. And in fact, in recorded history, most of the publications start with patients with neck masses. Then I talk about TNM staging, where we talk about tumor, node, and metastasis. In the traditional method, we don't talk about tumor volumes. I will try to emphasize how important tumor volume is in the prognosis for patients. And for nasopharyngeal carcinoma, as well as for other tumors in the head and neck, in the end, we still need to measure the volume rather than the diameter. The reason why we use only diameter measurement is because it is the simplest thing to do. But it's probably not an accurate way of doing it. So with the advances in sciences, we need to come up with a method to measure tumor volume and to try to correlate outcome with tumor volume, because ultimately it's the number of tumor cells that we need to deal with. So when we deal with an enemy army, we're talking about the number of soldiers we're going to deal with. So we have to know how many enemy soldiers are you actually fighting. Thank you very much.